Let me put it plainly. If the current funding model continues, WHO is being set up to fail. The paradigm shift in world health that's needed now must be matched by a paradigm shift in funding the World's Health Organization. We must look to the future.
And Amit Takar is the chairperson of the Africa Healthcare Federation. He joins us live from Nairobi. Amit, thanks for joining us. So we heard the Director General of the WHO say that the WHO was set up to fail. Is that saying too much?
I think he's being plain and candid and honest. If you look at what has been happening with WHO over the past 3 decades, it's been through a shift, like he mentions, the paradigm shift. Never ever has WHO become as strong as it has become because of the pandemic. Obviously, there are some losses and some wins, but you and I know, and every viewer knows about WHO more than ever before, and how they've been able to save lives and galvanize a unified healthcare institution in the world. It's time that we hoisted and supported WHO for the sake of future generations. That's coming out plain and clear.
So when we look at the funding structure of the WHO, which we just took a look at, most of it, 80%, comes from individual donors and individual country contributions. That sounds logical and right. So what are the best ideas out there that could help this current crisis situation in funding?
Look, philanthropy can only take you in globally to a certain extent. We are so fortunate that WHO has come so far from goodwill and well-wishers. Let's get the structure right. Let's have every country in the world pay a certain amount to WHO to keep economies and livelihoods safe. That's clear. It should be a structured, budgeted system which is non-negotiable as far as a country goes for WHO contribution. We are not safe until everyone is safe. And who tells us? And actually, we know that this is not the last pandemic. So do we want our kids to be hit with challenges that are more difficult than now? Of course not. So let's fund it. There's only one institution that can keep us safe from a Wuhan-like situation that might happen in the future. None of us want to go through this again. So it's very simple. Contributory sovereign funds earmarked with no questions asked, being informed by the Treasury, and it's a pot that keeps us all healthy, alive, and safe.
Okay, so the pandemic has been such a difficult time for the entire world, including in information processing, what people are willing to believe anymore. And at times, the WHO's messaging was a little murky. At times, it didn't say enough. At times, it would issue guidance that not many would listen to. Is it still credible?
Nothing starts perfect, but what they've been able to achieve in this pandemic is much more than if they didn't exist at all. At least 60–70% of the people around the world would say they learned a lot and it saved their family members and it saved communities. Is there room for improvement? Of course, like any institution. So we either are part of the solution or we become part of the problem. I choose to be part of the solution, and we need to strengthen, structure, and help WHO be the unified institution. I see no other alternate.
You know, one thing that you could say could be a big lesson learned was the need for wealthier countries to fund prevention in poorer countries, even if it's from the selfish perspective of we don't want other variants to develop. Do you think that has been rightly learned? Is that something of an insurance for the viability and the respect of the WHO moving forward?
Look, prevention is better than cure, and for sure we know it's cheaper than cure. To be blunt about this is there's been a lot of funds that have been sent by wealthier countries to developing countries around dealing with HIV, AIDS, TB, malaria, so on and so forth. Have we done a good job about it? Maybe not as much, because we've seen those indicators still not improving. Could we do much better than that? Absolutely. So I think to answer your question, there is a lot for us to learn, not only in health security and emergencies, but also getting the best value for the dollar in keeping communicable diseases and infective disease out from especially the developing countries.
Got it. Amit Takar, thanks so much for joining us.